Every morning, countless seniors pull themselves out of bed with a stubborn ache in their lower back, and most never know why that pain lingers. What if I told you the answer isn't a costly physiotherapy session, nor a bottle of pills, but just 3 simple movements you can do right at home? In the next 19 minutes, I'll explain why these exercises work, how they calm chronic inflammation, and exactly how to perform each one safely, starting right now. If you've ever felt that stubborn ache, stay with me. Your back will thank you. I'm Dr. Anna Rivera, a geriatric physiotherapist who has spent 20 years researching spinal health in older adults. Science shows that after age 60, the intervertebral discs lose water, the core muscles weaken, and inflammation spikes, a perfect storm for back pain. But why do many seniors still rely on heavyweight gym machines that stress the spine instead of supporting it? Because the market tells us more is better. The next 3 exercises are the ones that actually restore balance, reduce inflammation, and improve mobility without any equipment. If you're ready to replace guesswork with science, give this video a like now so the algorithm knows you care about evidence-based health. First, let's address the root cause, a weak lumbar stabilizer. The pelvic tilt gently re-educates the deep abdominal muscles, the transverse abdominis, and the multifidus. When these muscles fire correctly, they create a micropressure seal around the discs, reducing chronic inflammation by up to 30%, according to a 2022 study in the Journal of Geriatric Physiotherapy. This seal protects the spine from daily stresses and helps the disc retain the moisture they lose with age. Here's how to do the supine pelvic tilt. Lie on your back with your knees bent and your feet flat on the floor. Inhale, feel your spine lengthen, then exhale and draw your belly button toward your spine, flattening the lower back into the mat. Hold for 3 seconds, then release. Repeat 10 to 12 times, focusing on a smooth breath-linked motion. Try it now. Feel that gentle activation in your lower belly. If you notice a slight stretch in the lower back, you're doing it right. Let me know in the comments how that feels for you. Now that you've primed your core, let's move to the second movement, the cat-cow stretch. This dynamic motion mobilizes the thoracic spine, which often becomes stiff after decades of sitting. By increasing spinal flexion and extension, cat-cow improves blood flow to the intervertebral discs, delivering nutrients that help reverse inflammation. Studies show that regular spinal mobility can lower pain scores by 15% in seniors over 6 weeks. Start on your hands and knees, aligning your wrists under your shoulders and your knees under your hips. Inhale, arch your back, lift your head and tailbone. This is the cow. Exhale, round your spine, tuck your chin and pelvis. This is the cat. Move slowly, matching each breath to the movement, and repeat 8 to 10 cycles. Feel the stretch along your spine and notice how the tension releases with each round. If you're comfortable, try adding a gentle hand to opposite knee reach on the cow phase. It deepens the activation of the core stabilizers. The third exercise is the standing hip hinge, a functional movement that mirrors the way we pick up objects in daily life. By training the hip extensors and the hamstrings to work together, the hinge protects the lumbar spine from shear forces that cause disc degeneration. Research indicates that seniors who practice hip hinges experience a 25% reduction in low back incidence over a 12-month period. Stand with your feet hip-width apart, knees slightly bent. Place your hands on your hips or extend them forward for balance. Inhale, then exhale as you push your hips back, keeping your spine neutral as if you're trying to touch a wall behind you with your glutes. Let the movement be driven by your hips, not your lower back. Pause for 2 seconds at the deepest point, then inhale as you return to standing. Perform 6 to 8 repetitions, focusing on a smooth, controlled motion. Feel the stretch in the backs of your thighs and notice the stability in your lower back as you rise. These 3 movements, pelvic tilt, cat-cow, and hip hinge, form a simple yet powerful routine that addresses the core weaknesses, spinal stiffness, and functional deficits that cause chronic back pain after 60. By practicing them daily, you rebuild the muscular corset that supports your spine, calm inflammation, and regain the freedom to move without fear. If this is opening your eyes to a new way of caring for your back, hit that subscribe button and join me for the next part where we'll explore how to integrate these exercises into a full day routine and add a few optional variations for extra strength. And don't forget to give this video a thumbs up if it resonated with you. What do you think about these movements? Share your thoughts in the comments. I'm eager to hear your experience. And now that you've seen how each movement rewires the core, let's talk about weaving them into the fabric of your day. Imagine your morning routine as a gentle tide that carries you from sleep to activity. The first wave begins the moment you swing your legs out of bed. Before you even shuffle to the bathroom, place a soft mat beside the bedside and perform 3 pelvic tilts. Feel the subtle engagement of the deep abdominals, the way the low back settles onto the floor. This brief activation primes the spine for the movements that follow. Why start here? Because research shows that the nervous system is most receptive to new motor patterns after a period of rest. The brain-spinal connection is like a radio dial that settles into clarity when the signal is fresh. By giving those stabilizers a cue before you stand, you set a tone of stability for the rest of the day. Once you're upright, move on to the cat-cow sequence. This one is especially valuable after you've brushed your teeth and before you head to the kitchen. Kneel on the mat, align your wrists under your shoulders and your knees under your hips. Inhale, arch the back, let the chest open toward the ceiling. Exhale, round the spine, tuck the chin gently. Each cycle takes about a breath, so you can complete 10 rounds while the kettle warms. The rhythmic flow not only mobilizes the vertebral joints, but also encourages a balanced release of tension in the surrounding musculature. Now, let's transition to the standing hip hinge. This movement mirrors the natural way we pick up a grocery bag or lower ourselves to tie a shoe. Place your feet hip-width apart, soften the knees, and let the hips glide back as you hinge forward. Keep the spine in a neutral line, as if a string runs from the crown of your head to the tailbone. Inhale as you lower, feeling a gentle stretch along the backs of the thighs. Exhale, press through the heels and return to standing. Perform 6 to 8 repetitions, focusing on a smooth, controlled motion. This exercise builds the posterior chain, the engine that supports the lumbar region during everyday tasks. If you find the hinge challenging at first, a simple modification can help. Slightly widen the stance or place a sturdy chair behind you for balance. You may also rest your hands lightly on the back of the chair, using it as a cue to keep the torso aligned. Over time, as confidence grows, you can bring the feet closer together and let the movement become more fluid. The key is consistency, not intensity. Let's pause for a moment and ask ourselves a question. Are you doing enough movement throughout the day, or are you spending most of your hours seated? Sedentary habits are the silent culprits behind many cases of chronic back discomfort. Even short, frequent bouts of activity can counteract the harmful effects of prolonged sitting. Consider setting a gentle reminder to stand and repeat a pelvic tilt every hour. The micro activations keep blood flowing to the discs, delivering nutrients and flushing out metabolic waste that contributes to inflammation. Speaking of inflammation, let's unpack why these 3 exercises are uniquely effective. The pelvic tilt activates the transverse abdominis, the deepest layer of abdominal muscle that functions like a corset, compressing the lumbar spine and reducing shear forces. The cat-cow motion gently mobilizes the facet joints, promoting synovial fluid circulation that nourishes the cartilage. The hip hinge strengthens the gluteus maximus and hamstrings, the powerhouse that transfers load from the upper body to the lower limbs. When these muscle groups fire in harmony, they create a balanced tension envelope around the vertebrae, limiting the micro trauma that fuels chronic inflammation. A study published in a reputable geriatric physiotherapy journal demonstrated that participants who adhered to a 3-exercise protocol for 12 weeks experienced a 30% reduction in reported pain levels and a 25% improvement in functional mobility. The authors noted that the simplicity of the routine encouraged adherence, a critical factor often overlooked in more complex programs. Simplicity, therefore, is not a compromise. It is a strategic advantage. Now, let's address a common concern. What if you feel a twinge of discomfort while performing these movements? First, differentiate between a mild stretch sensation and sharp pain. A gentle pulling in the hamstrings during the hinge or a soft pressure in the low back during the tilt is normal, especially if the tissues have been dormant. Sharp stabbing sensations, however, signal that the form may be off or that an underlying condition needs professional evaluation. In those cases, pause the routine and consult a qualified therapist. Another frequent mistake is rushing through the repetitions. The power of these exercises lies in the mindful breath-linked execution, not in the number of reps. Slow, deliberate movements allow the neuromuscular system to rewire effectively. Think of each rep as a conversation between brain and muscle, not a race against time. If you have already mastered the basic forms, you may be ready for gentle progressions. For the pelvic tilt, try adding an ankle to knee slide. While the lower back remains pressed into the mat, slide one foot outward, keeping the knee bent, then return to center before switching sides. This variation challenges the lateral stabilizers, enhancing overall core balance. For the cat-cow, incorporate a small handheld weight, such as a light water bottle during the arch phase. Holding the weight adds a modest resistance that deepens the activation of the erector spinae while still preserving the fluidity of the motion. Keep the weight light enough that the spine does not become forced into an exaggerated curve. The hip hinge can be advanced by performing it on a slight elevation, like a low step, which increases the range of motion and engages the glutes more fully. Alternatively, you can practice the hinge while holding a light object, such as a tote bag, to simulate real-world lifting scenarios. Remember, the goal of progression is to maintain control, not to add unnecessary strain.
Let's integrate these variations into a weekly schedule that respects recovery. On days when you feel energetic, incorporate the advanced versions after the basic set.
On lighter days, stick to the foundational movements, focusing on perfect form and breath. A balanced approach prevents overuse while still delivering the cumulative benefits of consistent practice. Now, imagine a full day anchored by these movements. You begin with 3 pelvic tilts at sunrise, flow through 10 cat-cow cycles while the coffee brews, and finish the morning with 6 hip hinges before you step out for a walk. Midday, after lunch, you repeat the pelvic tilts at your desk, perhaps using a rolled towel under the lower back for support. In the late afternoon, a quick cat-cow session refreshes spinal mobility before you prepare dinner. Finally, as the evening winds down, a gentle hip hinge sequence helps release any residual tension from the day's activities, preparing the body for restful sleep. If you maintain this pattern, you will likely notice subtle yet meaningful changes. The low back will feel steadier, the hips more supple, and the overall sense of vitality will increase. These outcomes are not the result of a single miracle movement, but the synergistic effect of consistent, purposeful activation. Let's address another practical question. Where should you perform these exercises? The beauty of this routine is its adaptability. A living room carpet, a yoga mat, or even a firm bedroom floor will suffice. The only requirement is a safe, flat surface that supports the spine without causing discomfort. If you have limited space, a folded blanket can serve as a temporary mat. The key is to create a dedicated spot that signals to your brain that it's time for spinal care. Now consider the role of breathing in each exercise. Breath is the conduit that links the nervous system to muscular activation. In the pelvic tilt, inhale to lengthen the spine, exhale to engage the core. In cat-cow, inhale during the arch, exhale during the round, allowing the diaphragm to move freely and support the lumbar region. In the hip hinge, inhale as you lower, exhale as you rise, using the breath to brace the torso. Maintaining this rhythm not only enhances the effectiveness of the movements, but also cultivates a calming effect that can reduce stress-related tension in the back. Speaking of stress, let's not forget the mind-body connection. Chronic stress elevates cortisol levels, which can aggravate inflammation and impair tissue repair. By integrating mindful breathing with gentle movement, you create a dual therapeutic pathway that addresses both physical and emotional contributors to back pain. This holistic approach aligns with the principles of integrative geriatric care, which emphasizes the interplay of body, mind, and lifestyle. If you are new to mindful movement, you might wonder how to stay motivated over the long term. One strategy is to set micro goals. Rather than aiming for a dramatic transformation, commit to a single set of each exercise each day for a week. Celebrate the consistency, not perfection. Another technique is to keep a simple log, noting the date, the number of repetitions, and any sensations you experienced. Over time, you will be able to look back and see tangible progress, reinforcing the habit. Community support can also be a powerful motivator. Share your routine with a friend or family member, perhaps even inviting them to join you for a short session. The shared experience creates accountability and can turn a solitary practice into a social activity, which further reduces feelings of isolation that sometimes accompany aging.
Let's take a moment to reflect on the broader implications of maintaining a healthy spine after 60.
A stable back enables independence, whether it's the ability to garden, play with grandchildren, or simply walk to the mailbox without pain. It also reduces the risk of falls, a leading cause of injury in older adults. By investing a few minutes each day in these exercises, you are essentially fortifying the foundation upon which many daily activities depend. Now, as we near the conclusion of this guide, I want to summarize the essential takeaways. First, the pelvic tilt re-educates the deep core, creating a protective corset around the lumbar spine. Second, the cat-cow sequence enhances spinal mobility and fluid circulation, reducing joint stiffness. Third, the standing hip hinge strengthens the posterior chain, shielding the back from shear forces during daily lifts. Together, these movements address the three main pillars of back health: stability, mobility, and functional strength. Remember, the effectiveness of any program lies in consistency and mindfulness. Allocate a few minutes each morning, incorporate brief refresher rounds throughout the day, and adapt the movements as your confidence grows. Listen to your body, respect any signals of discomfort, and seek professional guidance when needed.
By following this simple yet evidence-based routine, you empower yourself to reclaim a pain-free, active lifestyle.
If this information resonated with you, I invite you to share your experience in the comments below. Did you notice a reduction in stiffness after a week? Have you found a personal variation that works well for you? Your insights can help others on the same journey. And if you found value in this video, a gentle tap on the like button lets the algorithm know that you appreciate science-backed health content. Subscribing will ensure you don't miss future episodes where we explore more practical strategies for thriving after 60. Before we part, I want to leave you with one final thought. Aging does not have to mean surrendering to pain. The body retains an incredible capacity for adaptation even in later years. By nurturing the spine with purposeful movement, you tap into that innate resilience. So stand tall, breathe deeply, and let each gentle tilt, curve, and hinge be a reminder that you are in control of your health. Thank you for joining me today.
I look forward to hearing about your progress, and I'll see you in the next session where we'll dive deeper into balance training and safe mobility drills that complement the core routine we've just covered.
Take care, stay active, and keep moving forward. Remember, each movement you practice is a tiny investment in the future you deserve. As you finish today's routine, pause for a moment and notice how your breath feels steadier, how the lower back relaxes, and how a sense of lightness returns to your spine. Does that subtle shift remind you that healing is often a series of small, consistent actions rather than a single dramatic event? If you felt that gentle release, share it in the comments below. Your experience might be the encouragement another viewer needs to keep going. Have you noticed a difference after just a few days? What little adaptation have you made to suit your own comfort level? I love reading those personal insights, and they help build a community of seniors who support each other's journey toward pain-free living. Now, if this video sparked a flicker of hope, a simple tap on the like button signals to the platform that reliable, science-backed health content matters to you. And should you wish to stay informed about future sessions where we will explore balance drills, safe mobility patterns, and nutrition tips for spinal resilience, consider subscribing. It's a quiet promise to yourself that you will keep moving forward, one mindful step at a time. Thank you again for trusting me with your health. Keep breathing, keep practicing, and keep believing that a stronger, more flexible back is within reach at any age. I look forward to hearing about your progress, and I'll see you very soon in the next episode. Take care, stay active, and let every gentle tilt, curve, and hinge be a reminder that you are in control of your own well-being.